to send kids back to school or keep them home.
It's just a tough call all the way around.
I think it's hard to have a one-size-fits-all.
Oregon pediatricians have different views.
We're talking about a long time to be out of school at this point also. And so people are trying to balance all that social, emotional health that kids are facing, the stresses of being at home.
We already know that kids' mental health has been affected by this sort of weird new world that we're all living in, an online school and not being able to see their friends. So I'm just wondering if 5 months of school is really going to fix that.
And so there's a lot of benefits, and I think those benefits outweigh any sort of small risk of COVID-19 transmission.
There's also the question, why risk it now?
Would you ideally like to see staff and teachers vaccinated before schools are open?
Oh, 100% sure. Now that looking at reopening schools, in a normal, or any sort of normal way right now, seems like it wouldn't maybe be the most ideal choice. It kind of seems like we should just sort of buckle down and get things under control and target next fall.
I think they should go back with protections, with feeling like they know how to protect themselves, with kids and families that are also compliant with that and ready to go back. I think there are ways to do that without vaccination.
Pediatricians do point out kids don't drive COVID infections. They're not as contagious and don't get as seriously sick.
And it's notable in Oregon that the hospitalization rates for kids has been less than 1%, and there have been no deaths of any children with COVID-19 in the state of Oregon.
A few months of data from schools of all sizes shows low transmission with strict safety protocols. Should districts choose to return, most students would likely have the option of continuing online, but teachers won't have a choice.
And I think a view that would be shared by most pediatricians is really always been more about the teachers, adult staff members, and older kids.
The transmission rates in schools among adults is going to reflect what's in the community. So we should take the same precautions for our adults in schools as we would do in the community.
And I think as opposed to people always facing it with a fear, I think we can flip that back and say, hey, I know how to protect myself. I can do this.
Many ask what the new variant of the coronavirus means for us and why risk schools opening now. Dr. Corey Fish, who you heard from Brave Care, says it appears to be spreading quickly and easily. Fortunately, though, the coronavirus vaccines out are mostly effective against the virus and testing can pick it up.